Hey guys, welcome to episode
Number 5
of the Night Shift Podcast. My name is Vilma.
My name's Emmanuel.
And we have our first guest.
Yeah.
Gabriella. She's one of my best friends. She's a registered nurse. Bachelor's? You have a bachelor's in? Yeah, in nursing. And I believe you have some other degree.
I do.
What
I have a BA in sociology.
Smart.
I try.
Yeah, okay, so we met a year ago. It's been a year.
It's been a year.
Exactly a year because, well, not exactly, like a year and a month because I started in September.
Yeah.
Yeah.
Wow, it's been a year.
And then,
That's crazy.
you know what, I was trying to look for, or like first messages because I don't erase no messages.
Oh, me neither.
And I was like trying to, I think, I do need my phone, but it's okay. Anyways, I was like looking because I started in September and I got invited to your Halloween party in October.
Yeah.
So in a month, like we became like very close in a month.
Yeah.
And I was like, But I was like reading the messages because you sent me, we had like a bad night. And then you sent me a message saying, oh, thank you for all your help. I admire your work ethic. You're a great nurse. And I was like, first of all, Gabby, I'm not a nurse, but thank you. But I was like, we became so close recent.
Yeah, we did.
Yeah.
I didn't even realize. I remember when you came for the Halloween party, she was the first one there.
Oh my God.
Because I said like 5 o'clock.
She said at 5.
Yeah, I was like, it starts at 5.
You know in Mexican parties that they always start later.
Like an hour and a half.
For reals.
So I was setting up the tables.
Yeah.
In las sillas.
That's all bad. Never do that.
No,
Don't
it was
get
so
there.
helpful, and I was like, oh, okay.
I was so embarrassed.
And I was like, okay.
And then I helped her with your costume.
Yeah, my costume, yeah.
Where'd you
We have
guys
to put pictures of that. I didn't dress as nothing.
No?
I literally just wore like a blue sweater, and everybody's like, "Oh,
Lame.
you should be a pure wick, bro." But this year we're gonna go all out.
Yeah.
Yeah.
But what were you? Say what were you?
My boyfriend was Pablo Escobar, and I was a bag of coke.
No, what? That's dope.
And she put like real flour.
No way.
Yeah, it was like
It-
a plastic. It was a shower curtain. I changed it. I made it into like a little bolsita, and then I was inside the bolsita, and it was like filled with flour, so it looked like the coke.
Damn,
and then my
that's
earrings were dollar bills, like rolls. You know?
No way.
Yeah.
Yeah, that's
Not
pretty
that I know.
cool.
But,
And so I didn't work that actually, and I think it was I think it was Ernesto's cousin that dressed as Mario and Peach.
Yeah.
And it was so cute. We'll put a picture of it.
That's dope.
Yeah.
Okay, so we're still continuing with part 2 of the
Mental health.
mental
awareness.
mental health awareness, and I want to answer the question that is said to be continued in the previous.
What was the question?
It was has my depression affected my goals?
oh yeah.
Yes.
That was a good question.
It was.
I agree. Yeah.
And I was like scared to answer because I think I did answer, but
It cut off.
like our camera turned off.
Yeah.
Yeah. So we just were like, okay, good night, let's go to
Yeah.
sleep. Okay, so, and my answer is still gonna be the same. Like I was telling him how it has affected me because I feel like I got nowhere, like with my school.
Yeah.
I said, I feel like if I would have had like the support that I needed, I would have like been a nurse already. And then with my weight loss goals too, it has affected me. Probably like trying to be a better mom or a better sister, like overall, or how. Like on my previous relationships, like 2 big relationships, I truly don't feel like it was my fault, but maybe the depression had played part of it. Maybe I would have got out of it sooner. Or maybe not, who knows. But yeah, it did. It does affect your life, I feel like, depression and anxiety and all that. What about you?
Me? Well, I mean, I'm a happy person, so I don't think I can answer that question. I'm sorry. I'm just telling the truth,
wrong with that.
I know, right?
Yeah.
But I don't know. I couldn't answer that question, honestly.
Good for you, sir.
Sorry.
Good for you, Emmanuel. Okay, so we have a few questions. Well, we have a lot of questions for you.
No.
So first of all, How long have you been a nurse?
I've been a nurse for 3 years now. Yeah. Officially, like, functioning as a nurse, 3 years this year. Yeah.
It doesn't seem long though, right?
No.
Do you still feel like a baby nurse?
Yeah. I still, like, internally, I'm like, oh shit, I don't know what I'm doing.
Really?
Like, half the time, I'm, like, just winging it. Just
Yeah.
getting by.
Well,
Like,
it
we'll
doesn't-
find Sasso,
it
I swear.
But it doesn't look like it.
Oh, thanks.
Because when things come to like, oh, that you need to do something, like you do it. Like you don't stop and think, oh, what do I need to do?
Yeah, but it's taken like the 2.5, 3 years now to get to that point.
So is the ER been your first RN job?
No, it's my second.
So
my
what's
first
your
year, my first year I started as a mental health crisis nurse for kids. So like 6 to 17 years old, I would do like physical assessments for them. It was like more like just a really long questionnaire. That we were part of like a 4 or 5 person team. The kids would come to us if they were in like a mental health crisis. And we were called like a crisis stabilization unit. And we were 24 hours. So like the ER, but you know when kids come to the ER and they're like on a hold or whatever, we could take those kids, even if they were on a hold, we could take them, bring them to our unit, and then we would do the assessments there. So that they like, cause you know they like wait for 72 hours and they don't get anything, they just sit there. So we
because of the insurance they have.
No, just because there's no child psychiatrists. They have to be
correct.
seen by a child psychiatrist. Yeah, so a psychiatrist for children and adolescents, and a lot of adult psychiatrists aren't gonna just be like, yeah, no problem, like you can go or you can stay, or you need to stay or you can go, you know. So we were kind of like that in between, so they could come to us. I would do like their physical assessment, make sure that they were like medically okay to be on my unit because we didn't have anything, like we're not a hospital or even like a clinic. They would come to us and we would do that. Then they would talk to the clinician and get their evaluation done. And then they would, if they could go home, they would talk to our psychiatrist and he would just be like, yeah, they're good to go, or like, no, maybe we should keep them and transfer them.
So you guys had rooms too?
We had rooms. We were 4 rooms, so we could take up to 4 kids at a time. 1 nurse and 1 clinician, and then 2 counselors. So like 2 CNAs.
Oh wow.
Yeah. So
How
that's
long
what
were
I
you
did.
there?
As a nurse, I was there for a year. As a counselor, I was there since 2016, 2017. Right out of college, like my first degree.
Okay, and then you went back to school for nursing? And then that was your first job as
a nurse.
Why did you move to the ER?
Because I wasn't marketable. Like in the nursing world, like you need to at that point I understood I needed to have more skills. Because where I was, like the most I did was do flu shots. Like the psych stuff I got, I could do that. Meds, I could do that. But like the real world, like hands-on stuff, and especially because I went to school during COVID, I didn't get those hands-on things. So I needed to get it somehow. And I was running out of time because no one wants to train the 2-year-old nurse from the start. They'd rather have you fresh out of school to train you and build you up.
Because she wasn't in the behavior, like in the green zone. She was a lot when I first started. Why do you think they moved you to like the other pods now? Because you got hired as a behavioral nurse, right?
I got hired as a behavioral health nurse in the emergency room. That's like my official title, behavioral health in the ER. But I think because I also have to take medical patients, and like I do, like the more people, more staff we have, like I have to be able to do all of the things. Like I can't. They said.
What happened? Did they move?
No, I think it's this.
Babe, hurry up. You're cutting the inspiration here.
I know! I
Bruh.
think it died.
Bro. Where were we?
So.
I don't know, I think he just farted though. I think I just swallowed all of it.
Theo, why would you do that?
Did you get it?
Funny. Oh my god. No, I can't smell it, thank
You
God.
nasty, Theo.
It's okay. I forgive you. It's good.
Because he's cute.
Yeah.
I think we left off when you were talking about why.
Oh, why I'm in different pods.
Yes.
Yeah. Yeah, because I have to be able to do all
Everything.
things. Yeah, I have to. Yeah. Everyone does. Yeah, I think it just depends too on like where you are needed. If I'm needed here and there's someone to be back there.
Yeah.
Yeah.
Where do you, what pod do you like more?
I just like to not work.
I everybody does.
Amen. That's why we're doing this. That's why we're doing this, because we're gonna get famous.
I do
and
think Pod B though. I like. Yeah. I think we have a good team back there. The shift goes by so much more smoothly.
you know, and everybody's like, "Oh, you guys are fine. It's Pod B." Like, bros, like we're always full.
Mm-hmm.
Like
Yeah.
even if it's not psych patients, we're always full. And when I don't have full day, it feels like I work more. So I just rather sit.
That's bad.
What's bad?
That we would just rather not.
Oh, Emmanuel.
What?
I can't hear anything.
I know, cause.
We're back for the third time.
Mm-hmm.
Okay, so what were we talking about? Where you like to be most?
Yeah.
And you said nowhere.
No, she didn't want to work.
I just don't want to work.
We don't want to work.
No.
Okay, so you know why I thought you had like a minor on psychology? I don't know why.
I think a lot of people get those confused, like sociology, psychology kind of thing, or could you think or you hear therapist and you think like psychologist or psychology, you would assume.
So that was my next question. Like, why did you choose nursing versus
Sociology? Originally I wanted to do social work. I thought that was what I want. Like, I remember following this agency that I worked with for like 2 years before graduating. I was like, I need to work for this agency. And I submitted an application, and they also had at the time, I think they had some sort of like program or link or discount or whatever with USC's social work for masters. And I was like, I'm going to do that. I'm going to work there. I'm going to get the masters and like get the discount and blah, blah, blah. And then I'm going to like be a licensed clinical social worker. And the more I worked there, the more I learned that like it takes forever. It takes so long to become a clinical social worker, like to do all of the stuff that they do. I'm like, it takes.
Well, after you're done with school, it still takes a long time to.
Yes. So like you go. So I already would have had my bachelor's. I would have to do 2 more years for a master's, and then do all the hours, and then take tests, and then get a license.
But do you think if it was something that you loved, it wouldn't matter? Or
Yeah, and I think that was the other part, is that I didn't love it as much as I thought I would. I think like the reality of everything set in, of like people suck.
They do.
It is true.
Everywhere though.
Yeah.
I was telling him, I think when we caught up on our last episode, we were talking about that I was at Chipotle and I was waiting for 30 minutes. And I was so happy because it was just me and Joseph home, and I was like, you know, I don't have to cook and I'm gonna eat Chipotle. And everybody was so mad. And then the cashier was talking back to the guy that was screaming at him, which he should, because bro, why are you screaming at me?
Yeah, you're at Chipotle.
So it's like you said, I think
not that serious.
I think it's just like, I don't know if people's getting worse or our patience it's getting like shorter and shorter. What do you think it is? Because
there's just so many factors. I think going, and this was before COVID, before everyone's like, you know, no one understands how to socialize anymore, or like we're all weird. During like the first couple of years as a counselor, like you have to deal with families. You have the kids. That's one thing. Kids are already like a thing in their own thing. That's like a lot to work with. But then you have their families, and then you have their resources. So like their therapists that all don't answer the phone, or like their school that like their teachers don't like, you know, said something, or like they didn't do something about like the kids bullying them, or you know, all of these things, or the police that just like call because like, oh, the kid said this, and so like, you know, we brought them, or like, you know, we said this to them and they got mad, and like all of these different things. And I was like, there's too many people to manage. Like I can't.
Yeah, that's why I couldn't work at the peds unit. I can't deal with parents.
Yeah,
like
and you're a parent, so like imagine like. I'm not a parent. I didn't know what that was. Like, you know, the most I could say is like I've seen other parents and trends.
You're
or, like,
very patient.
Me, yes, I am.
Yeah, I don't think I'm like not a patient person. No. I think it was just I didn't want to.
You're just overwhelmed.
Yeah, I just didn't want to keep seeing the same thing, like the same thing after giving people like answers to their questions, and then still, but it's also the same in nursing too.
Yeah,
like,
the same
like, hey,
thing.
stop smoking, and they're like, I'm sick because of this, and it's
For
like, no,
real.
it's
Or
because you're smoking.
drinking. Or like stop
Yeah.
drinking. They're
Yeah.
like literally there because their kidney
Yeah,
is like
the kidneys and the livers are.
and then they're like, oh, I just had a drink before coming here.
Like, that's crazy.
Yeah.
No, so I don't want to do that.
Yeah.
I don't want to do that.
Damn.
And then it was with the kids, because I'm like, the kid, it's already hard enough figuring shit out at that age. And,
I mean,
you know?
you're still very young. You just turned 30.
Yeah.
So you were a new grad.
Mm-hmm.
I mean, you were 27.
Mm-hmm.
So
Yeah.
you're still trying to figure out life too and what
Yeah.
you love.
Yeah.
So now we're gonna get into like the questions I've been wanting to ask for like not like for people in general, but mostly for my daughter, for Yvette.
yeah.
Because she just started her freshman year in CSUN.
Yes.
And I feel like she's going through what you went through. And I do understand her, but I feel like she, like, you know, when your mom tells you something and you're like, I don't know anything.
Yeah.
And then you have to hear it from someone else to be
Yeah.
like, oh, okay, maybe
Yeah.
she's not wrong. Or
Yeah. Mm-hmm.
And
100%.
yeah. Oh, well, one of the other questions is, what did you learn in nursing school? Because nursing school is 2 years.
Yeah.
Nursing school, and I've heard every single nurse say, I didn't learn anything in nursing school, that it's
Yeah.
hard, but that there is like the books and actually like the bedside, it's very different. So what did you learn in nursing school that you still apply to this day? What do you think?
My program was 15 months too. That was the other thing. It's like it was an accelerated program.
Wow.
Even after everything. And then it was supposed to be accelerated, but then we went online because of COVID. So I didn't get the hands-on thing. So I think for me, I really didn't learn anything in nursing school. Like when people say that, like I'm like, you probably learned something. Like you probably learned how to like prime a line or like.
But you
spike a
don't,
line.
right?
I didn't. I had to watch a video.
Oh, wow.
Well, it's not the same as like being in the emergency room and like trying for a Foley for your first time on a patient and things like that. Like I couldn't touch anything.
Yeah.
So hands-on wise, I didn't learn. But I think more like teamwork wise, I learned like that everybody brings something specific to the table. Like everybody has something that they bring and can contribute to the team and that you can learn from. That was one thing that I think I like really appreciated. Like my friends, we all came from different backgrounds. That was the other thing is like my program was at CSUN and it was an accelerated program because you had to have a bachelor's already to do the program. And so there were some people that were like moms of, they had like a kid and she was like 45 and like restarting.
Yeah.
And she had been like an actor or an actress or whatever, like doing like show stuff for like the longest time, and then was like, I need to do a different thing. And so she went back and started nursing. Now she's a nurse.
Wow.
Like Children's Hospital and stuff. Or like someone did this, like they did like insurance stuff, and that guy was a little strange, sorry. But he was also a nurse. Like everybody came from different things, and we.
So that's what you learn, and you apply like a team. You have to work in a
everybody
team.
has something that you can learn.
Yeah.
From like
Every
there's
day.
something you can learn.
Every day
Yeah,
I learn
every day.
something. Even at the ER, I'm like,
Yeah.
I didn't know that.
Yeah.
Yeah. Do you want to be a nurse?
No. No, I don't have the patience for that.
We
Like
need
I see
more.
what you guys do, then I'm just like,
We need
nope,
like
I'm
more
good.
male nurses. What do you think? There's
think
not
so,
enough.
too. Yeah.
I mean, I start seeing more and more, but I don't see enough. Right?
Yeah.
I'm trying to get Max and to talk about why he decided to do the program he did as well. But I'm like, so my son could see.
Yeah.
So Antonio could
Yeah.
see too. I'm like, hey, do you want to be a nurse? Do you see him as a nurse?
No,
No?
maybe something else, but nah, not
You
the
don't
nurse.
see him as a nurse?
No, maybe nurse for behavioral. Maybe.
Antonio?
Yeah.
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 Like Kyle. Tall Kyle?
Yeah.
He's a behavioral nurse.
Yeah. Yeah.
Right?
Yeah.
He has
Wait, how
long
come
hair.
you didn't pursue that? Going
Behavioral
to
health.
the behavioral health.
Oh,
the
that's a
hospital.
good question.
Like the psych unit?
Yeah, yeah.
Because I don't like adults.
Really? Well, there's also the business.
don't like people.
Really? Damn.
No.
I feel like everybody's gonna understand.
Yeah, it's
People is just difficult.
Because for kids, like for me, it's like kids are kids. Like they're still learning shit. Like they're still learning.
Yeah.
And our job is, as providers and like caregivers and all that stuff, is to like help them figure it out. Not give them the answers, but like help them figure it out. But, like adults, like
you should know already.
Yeah.
Come on.
What else? What you want it on a silver platter? You
That's
want it
true.
like fed it in your mouth? Like you want to hear? I can't do that. And also. But like, and also there are other things that like you just are just out of your control as a provider. Like I can't change your insurance to get all of these things that you need, or
That's
like
true.
I can't.
That's the sad part.
Yeah, it's all of those other things, like the system part of things that I just like I can't, because there are people with true like really detrimental mental health diagnoses that struggle like functioning in their day to day, that can't get the things they need because of like the system. That's just how the system works.
Yeah.
And that's also really frustrating. Like how do you teach someone who already has mental health stuff to go through how to also navigate the system?
Yeah.
That's like a lot.
Yeah.
It's like I think that's more like heartbreaking than anything.
Yes, and I see it with the minors that we get at work, even if they're like about to turn 18, that we literally, if the police officers bring them, they're literally on a hold for 72 hours, and if they don't have good insurance, they stay there. So there are psych patients, and they're not getting any help because you guys literally don't do anything.
We can't. Yeah.
We don't do anything. You're just in a room for 72 hours, and that's it.
Yeah.
What do you think they can do differently there if you guys did have those resources?
There's resources for kids that have insurance.
No, but for those kids that don't have insurance.
See, that's the other thing. Where I worked, the county asked for the services because the agency that I worked for was actually based up north, like San Francisco area. And the county, Ventura County at the time, was like, we need that. Can you do that here? And we will pay for it.
Was it a nonprofit?
Yeah.
Mm-hmm.
And so it was like under the county, and so the county like would fund things. LA, can you imagine doing that for like where is that going to come from?
That's
For
true.
LA. Like so if there are people who can do those things, it's just again the system can do those things and like can't like where's that money going to come from? How many people
And
like we can't just serve 4 at a time in LA. Like it's not, you need multiple of those of this kinds of services, and that's just hard to fund. It's hard to find the people. Yeah.
Yeah, I remember trying to get help for Antonio when he was a few years ago. Now he's 17, but they've always had, when we moved here, we got the is it Medi-Cal? Medi-Cal. So I called every place. Hey, do you guys take Medi-Cal? No, we don't. And it's probably like $3,000 to $4,000 a month for your kid to get help.
Yeah.
So yeah, if you don't have good insurance, like our kids are
Basically.
Yeah.
they're screwed.
Yeah.
Like either counseling, like you have to really find like a counselor that cares
Yeah.
and that it's like a low income and just hope for the best.
Yeah. It's unfortunate.
Okay, so let's continue. We're gonna be talking about Gabby. Gabby's in a happy relationship now.
Yes, I am.
She's older. She's an adult. She's adulting.
Trying.
We're all trying.
Yeah.
Yeah, we're all trying.
So you told me when we talked, you mentioned Chris,
Yeah.
your ex, and I want to talk about this because it wasn't. Did you think that okay, going back, were you happy with Chris?
I think at the time, because that's all I knew.
That's how old were you when you started dating?
I met him when I was 14. I was a freshman in high school.
Oh, wow.
Yeah. And he, like, at 14, everything is, like, a big deal.
Yeah,
High school is a big deal. Everything, you think you know everything, and really...
You
it's
don't.
like, thanks, Mom, because she's the one, like, when you get older, you're gonna see, you're gonna know. And I'm like, they don't know anything. And here I am, like, yeah, you're right. Listen to your mama.
For real.
So you dated him since freshman year in high school?
Since freshman year in high school.
Until
and
when?
then we were, like, on and off a little bit, you know, that drama in the high school world as like a teenage love or whatever. And then we reconnected my senior year of high school, and then dated through like my first year and a half of college up until he passed away. Yeah.
What year did he?
2014.
And you graduated in 2017.
I graduated college in 2016, graduated high school in 2012. Yeah.
Did you take a break when he passed away?
Yeah.
Like a year break or?
I don't know. I don't think it was a year.
No.
No. But I also didn't know anything about that. So, like, I don't.
Yeah.
Bless you.
So Gabby has this, I don't think, did I show you her, is it writing blog?
That's a blog. Yeah,
it's
I would
like-
call
No,
it a
you
blog.
never
I
did.
told her that she needs to write a book because I was just like, literally, I was reading it. Like, it's like when she was going through a hard time, she would just write it down. I'm like,
Yeah.
and I was just like crying because it shows again that we don't know what people are going through.
Yeah.
You know, you could look so happy in the outside, but
Yeah.
you're like dying in the inside.
Yeah.
And I was reading it and I'm like, if you wrote a book about this, I think you will help a lot of people, a lot of young people.
Yeah.
Because I was reading a book about I think it's called, I don't know, I have to put a picture of it, like everything. But anyways, literally it's about depression. But I read maybe like 5-6 pages and I was like, no, this is not for me.
Yeah.
Like I couldn't feel like they could, supposedly she was going through depression, and it's like, you just need to snap out of it. And it's like, no, it doesn't work. Like I don't feel like for me it works like that. Like when you go like in a what would you call it?
I call it a valley.
Why?
Like when I'm in a dark place,
Mm-hmm.
like I'm in a valley. Like I'm in a lull,
Yeah,
Trying to-
kind of makes sense.
trying to get out.
Yeah.
Yeah.
But I feel like if you like you do need to think about it, writing a book, because I
will.
feel like that like little bit of that I been reading, it has I'm like, oh wow.
Yeah.
And I feel like it will help a lot of young girls.
Yeah. And for Emmanuel, who doesn't know, he's probably like, "Who is Chris? What the fuck
Yeah,
happened here?"
who's Chris?
Yeah, I'm trying to figure. But
Trying to
you
figure
know,
out
from-
his-
I'm trying
from
to
what you
ask
told
like a
me,
nice
you know?
way.
No, yeah.
Do you want to share how did he pass away?
Yeah, I'm not
Yeah.
like shy about it anymore. It's been 10 years. This year was the 10th year, like 10 years since he passed, which seems like crazy because I remember like a couple weeks in, I was like, how is like life ever gonna go on? Like I don't understand. But 2014, it was after my birthday. It was March. He had just left because we had winter break. He spent like winter break with me. And he was in the Navy. He had enlisted in the Navy, and he was in school for that. Got winter break, so he came for the holidays. And then after that, he left. And then in March, there was like a big old fight, and he died by suicide.
Damn.
Yeah, and I was the last person to talk to him. On there, like when I look back on it, because you know, like now I can see everything. Now I can understand all of like the signs and things that were there, and I knew there was something, but I didn't know what it was called or what it was related. Like I couldn't piece all of that together. I was 20 years old. We were 20 years old. Like what did I know at 20 years old?
Nothing.
In college? Nothing.
Nothing.
I knew things weren't okay and they weren't right. And yeah, so he passed away March 2014. Yeah. Yeah.
Did so were you in nursing school?
No, I was at UC Santa Barbara still.
Oh, okay.
Yeah.
So not nursing school.
Yeah. Yeah.
What made you want to write about it?
I was like overwhelmed. I didn't have anything to like. I didn't have anywhere to put it, and like when someone passes in that way, I think just in general, but like
Yeah.
when someone passes like that, it's like what you feel like literally no one understands unless they've gone through the same exact thing.
Yeah.
They don't understand nothing, and it feels like I was just like really angry, I think too, and I didn't have anywhere to put that anger, and I didn't know what it was like consuming me. like how you talked about like the couch consuming.
Yeah.
Like that was like my anger. I was so angry because of all of these things, and it was like anger over like the situation, and anger over like now I'm here and I feel like I'm by myself, and how am I supposed to like continue, and why do I have to like go through this grief? I'm 20 years old. Like that's not fair. I had a really hard time like continuing in school, continuing with friends. And so I was just really angry, and I would write like Instagram posts. Like I would like write like paragraphs long, and I'm like, I can't keep doing this. Like this is dumb. I also felt like dumb. And I was like, who fucking cares? No one cares.
Yeah.
And I think I had read someone's like, I don't know if it was like I saw someone who kind of did something similar, or like people would write, and it was just about something totally different. And I was like, I don't know. I wasn't good at therapy because therapy had like been a terrible experience.
Mm-hmm.
So I just wrote it down, and
Did it help?
it did.
And like going back and reading it, do you like read it?
I read it and I cry, and I'm like, wow, like look at you
now
go.
here.
Yeah.
I know. I was
Look
so
at you
happy
go.
because I'm gonna let you. I'm gonna show it to you, but I was like, I'm just so happy you're here because she was in one of those moments that her parents put her in a 5150 at her house.
No way.
They pretty much like kept me home. My dad would not let me leave.
Damn.
Yeah.
Because she's like, I don't want to live anymore.
Yeah, it was bad. I had started writing in a journal before that. I still have the journal. Like I would write to Chris, and like my day, like Dear Diary, but it was like Dear Chris, and I would like write everything that happened. Yeah, and then that's one of the times. Like I also wrote in there like I just don't want to exist in this world because to me like I just like nothing made sense anymore. Like what was the point if nothing made sense?
If the person that you loved wasn't here.
Yeah, and how like to me it was like so fucked up that everybody just kept living.
Yeah.
And I was like, and I'm just here not living. So like what is the point? Never wanted to like harm myself, but I think that time it was after my birthday. I had gone out. I was really, really, really drunk, and I called my parents. I called like all these people, and then I called my parents because like no one else was answering, and I was like, no one else like cares, and I just don't want to do this anymore. I'm like a failure. How can I be 20 years old or like 20 whatever and like be living like this with these experiences? Like I'm too young for this, and I don't want to do it. Yeah, I was hurting. I was really hurting, and my parents were like, absolutely not. And they showed up at my door, and I lived in like Ventura County, so they went from here to like Ventura County, picked me up. They said, you're packing a bag. I don't care. My dad put my dog in the car. He's like, you're getting in the car and we're going home. And I sat, and I just sat and cried like 3 days on the couch. Just sat and cried with my mom, and they were just like, watch me cry.
That's what we do at work.
That's true.
But see, it's like, like I feel like your parents know best. Well, good parents would know how to help you best, right? Yeah. At the moment, you might like not like it.
Yeah,
but now it's like that.
I know I needed
saved your life.
It saved my life.
Yeah.
I probably I could have done a lot more harm to myself, like being alone. And then like looking at my dog, and I was like, fuck. I just adopted you. I can't just leave you hanging. Like I can't just leave you by yourself. So that was the other thing that I like also kept me going, was like I had a responsibility. That was
you had a baby.
Yeah.
You had a baby.
Yeah.
So when did you notice you were going through this depression? When?
I think when Chris died, people were kind of expecting me to go to a dark place. Like they were concerned. Like I think that is like a common concern. Like that's when someone dies by suicide, everyone's like on watch. Like, is everyone else going to be okay? Is someone else going to do something drastic because of like what just happened? So I remember my godmother was like, you need to go to therapy. Like you need to go to therapy like as soon as possible.
Did you?
No.
I mean, who would?
I mean,
would you?
We tried.
Especially
I
after something like
tried.
that?
Yeah.
Well, I don't even go to therapy now.
Well, there you go, you see.
Yeah.
I mean,
it was because I didn't go right away. But also because he died like the week before my finals week. So
you were busy.
I was busy.
This is what
It's
we were
even
talking
worse.
about. Like when you're just busy and on the go, you don't have time to like
stop and.
But
realize.
because that's your body, and then you just like when you're relaxing, your body stops. I feel like everything just consumes.
Yeah. It's hard to like move.
Mm-hmm.
Yeah.
So was it like years after that you got depressed?
No,
Or?
I think like also people are expecting me to be depressed.
Mm-hmm.
So kind of, I think it just, I didn't realize I was until I went to the doctors for something totally unrelated, and he asked me something, and I just started crying.
Oh.
And then he was like, "What's going on?" And I was like, "Well, all of this happened, and like, you know, someone really close to me died, and and he was like, "I'm gonna put you on these," and that's when he put me on meds, and I was like, what do I do?
Is it different though? Like, so did you see that where I see those what commercials about depression pills or and you know how it starts always like the commercials, like the mom or the person is like very like just like and then like
zombie.
everything is like grayish, not colorful, and then you take the pill and then everything's like flowers.
No.
It doesn't feel like that when you take pills? Or does it feel like...
The fog is for sure. Like, I have a fog.
A fog.
There's a fog all the time.
Fog.
Yeah.
Not
There's a fog.
colorblind.
Not colorblind. No, not colorblind. No, but there's like a fog. Like, it's always just like foggy. Like, your brain is foggy. My brain was foggy. Like,
Have you ever been through that? Felt like that way?
No, never. It was just like mid. I don't know. Like, I was just sad, but not to the point where like it was fog like that. How you guys are saying? No, never.
When was this?
It was a while back. I mean, I think it was high school.
Yeah.
Sophomore year. Yeah.
Yeah. The fog. It comes eventually, though. I don't think it's like rainbows and butterflies, but I feel like I'm more normal functioning. I can concentrate. I can go to the store and not want to cry.
Yeah.
There was this one patient that we had that she doesn't drink her meds, so she drinks them and then she feels better, and then I guess she stops, and then she says that she has like her cousins telling her, "Oh, that's a placebo."
No.
And I'm like, it's not.
I'm gonna tell you right now.
Did I ask you? Who did I ask? Did I ask you? Is that a placebo?
Yeah.
Right?
Yeah. No.
And I'm
I
like,
think it's like actually. I'm on meds. I've been on meds for 2 years now. 2 more years, because I would go on. So I didn't take them right away. Then I started taking them, and I was like, am I gonna be someone I don't know? Like, am I gonna be myself? Like, how do I know what is me and what is not me, and what is the meds, and what is like actually organic in me? That really weirded me out. I was really nervous about that, because I was like, if I'm happy, is it because I'm on meds, or is it because I'm actually happy?
but you were, like you said, like in a dark place. So you were not happy. Were you anxious all the time?
I was, yeah. And the other thing was, my doctor was like, "Well, you're depressed and anxious." I'm like, "Oh, that makes a lot of sense." So I got my mind is like, "Don't do anything. Life sucks. Just stay on the couch forever." And then my other side is like, "You're a failure if you don't get up and do all of the things on your list right now."
See, it's not called lazy. Yes, you called me lazy.
Though.
No.
Okay.
No.
Yeah, there are like days where I physically could not get up out of bed. Like physically could not. Well,
you haven't had those moments though. Only that one time, remember, where we were in bed and you just woke up and you were just like
numb.
Yeah, she was. Yeah.
Yeah.
And I was just like, and it was the first time, and I was just like, well, what's going on? Like, what happened? Like, what do I do? And I just didn't know what to do. I tried to do everything, but it just didn't work.
It doesn't.
It doesn't. It can.
But it took like time, you know?
It takes time, to figure it out, Yeah,
that's why I was telling Emmanuel maybe I should go on meds.
I did. I heard that today.
Yeah,
I'm all for it. It's life changing. I'll probably be on meds for quite some time.
I think it's affecting your life, and I mean I have 4 kids, you know, and my sister was telling me too. She told me this a long time ago. She's like, well, it's kind of like you're abandoning your kids too when you go to sleep. Yeah. So then that got me very sad, and it's true, you know. So I'm not just hurting myself; I'm hurting like everybody around me, and now you. Yeah. You know, like you're like, what the hell is going on? Yeah. So probably, we'll see.
I wouldn't say abandoning. I mean, it makes things difficult, and like, you know, but I think language also plays a big part. Like to me, like my medication helps clear my brain. It helps me settle enough where I'm not anxious all the time and can like, I couldn't go to the grocery store without like freaking out and leaving. Like the sounds were so overwhelming for me sometimes. Like I couldn't, you know how people just go to the mall and like grab and shop and whatever.
Yeah.
I couldn't do that by myself, like at all. I couldn't sit and have like a meal by myself in the food court. Like, cause that just the sounds, like I was paranoid, like people were watching me or people were like talking about me or like they noticed the way I was dressed. They noticed like that I touched this and put it back. And like, what if they think I'm like sick and they think that now there's germs on that bag of chips and like, what the fuck?
Yeah.
That's tiring. No,
It's
like
exhausting.
like your
And I
mind
have
is just like constantly.
My mind was constantly going, and at the same time, it was saying, "Go to bed and stay in bed." So like, what do I do?
That's how you were, no? When we went to IKEA, and you were just like, "No, I don't want to go because I feel like I'm gonna be like I'm trapped because there's no exit. It's just one entrance, and then that's it." And then she was just like, "Oh, I don't want to do this." You know, I was like, well, we can, you know, overcome this fear. Like, let's do this.
Yeah.
I was like, it took a while. Yeah.
And that, he's like the medicine. Like, let's overcome this fear and get,
You're my drug.
I know, right?
Yeah. But it does provide a lot of clarity.
Yeah.
I mean, it's a trial and error. And people who go, like, cold turkey, like, who just stop taking it, fuck. That's just hard too. I did that once, and I almost took myself to the emergency room because I was like, something's wrong.
No,
something is physically wrong with my body.
Yeah.
I felt so sick, so terrible. So that's also like not fun. Like, it's not just like any medication. Like when you take a heart medication and you stop, and I was like, why is my blood pressure so high? It's because you stopped taking your medication.
Yeah.
Why am I so anxious?
So depression is like is it like forever?
No. I don't think I'm depressed anymore. I think I have bouts of depression. I think I have like days where I'm more anxious.
Do you think it's a medication? It's a mosquito.
Yeah, 100%.
Yeah, that's
100%.
helping.
Well, it's a combination of things for me. In my study, I understand that therapy and medication are the best combination. Those two need to go together for you to like make progress, I think. And so I started with medication, and then I then I stopped, and then I went back, and then I stopped, and then I went back. But I also started therapy before nursing school because I was like, how can I do all of this work and then not like practice what I'm preaching?
Yeah. And I feel like so you were telling me that work offers like 6 sessions, right? For free. And so I believe that not only our job, I feel like even school, because Yvette was looking to it, and they give her like free like consultations. So I feel like if you guys feel like you need help and you don't want to talk to your family or friends or you don't want nobody to know, just contact would it be HR? No. Who would it be?
It's like on like the employee help, like employee resources. We have that. I know at school, like that's where I started trying to go to therapy, and that's because my godmother was like, "You need to go." And so eventually, I did.
And is that for free?
It was free there, but my case was like your special case. We need you to go to like another thing. So they like referred me outside.
You're special. You're special.
Because like they didn't do grief counseling. So there's different kinds like for specific things, and theirs was like mine was kind of like trauma. Not kinda. It was. It was trauma, and they were like that. They didn't have the tools or like their practice wasn't focused on that. It was more like school-based stuff, like family stressors, school stressors.
Yeah.
How do we help you navigate those?
Did they help you pay for that though? For that or no?
No, I paid for that out of pocket. That was the other thing. Is like
it's expensive.
Was like $60 a week. I would have to spend an hour on the bus to get there, an hour back during school, like, and going to work part-time, and it was just a lot. So I didn't do it. But I was also like freaking 20 years old.
Yeah. Do you think you would take therapy if you needed? If you felt like...
I would, but the thing is, I feel like I would have hide it from my family because they're not big on getting help. I'm talking about your feelings. Because, you know...
No. And not
Hispanic,
in our culture.
Yeah, not in our culture. We cannot talk, especially for guys.
Yeah.
No, that's even worse.
Yeah.
Like, they'll tell you, like, oh, you're sad? Go do something.
Yeah.
And it's like, no. But yeah, I would.
Or what do you have to be sad about?
Yep.
Well,
did you see that?
Yeah, he kicked it.
Yeah. But you would. You're not against it.
No, I'm not against it.
Because there's people that even I know nurses that are like, oh no, I don't need therapy, and I'm like, I'm pretty sure you do.
Yeah.
Well, I think also just our language around therapy is that you go to therapy because there's something wrong.
Mm-hmm.
People can go just because they want someone else to fucking talk to.
That's true.
And I was telling him, and I keep seeing this on TikTok, it's like people that work like in ICU or in the ER, you know how we see death, like nothing, like, but then like there's some days that you're like, oh, my patient just coded, or just, and then you go and eat lunch, you're like literally like like nothing happened, like who like sees that, you know, like not everybody.
Or like for you guys, like, oh, so and so, he just went to try and help and he got punched in the face. Or like bro, like when you go to site, where do you put your anger? You know,
it's crazy. There, right there, you just gotta watch your back every single time you enter.
Like isn't that tiring?
Yeah, it is.
Yeah.
No, even when I'm in the ER and I seen like patients coding, and then the worst thing for me is like their family's just right there watching.
I don't like that.
And I'm just like, dude, why are you here? Like, go somewhere else.
Yeah.
Like, I'm just.
But the doctors want them there.
Yeah.
I asked that question when I first started, because in
like,
ICU,
because it's supposed to be like a closure thing.
Mm-hmm.
Yeah.
And in ICU we wouldn't. We will like get everybody out, like out.
Yeah.
And then, but it does make sense. But it's like it makes sense that you need to see, because people that, you know, you take your family to the ER, and then all of a sudden if you're in the waiting room and they're like, oh, if say we were coding a patient for 30 minutes and then they didn't make it, and then you go and tell their loved ones, oh, he died, you're like,
yeah,
what the hell? So I kind of get it, but
it's traumatic.
Can you tell her about that one time that you saw somebody code?
Yeah,
that they were coding someone. Is it that one time?
It was that one. Like, it was.
So
in Bed 11.
you haven't seen anyone else code?
Besides that, no. Like, I passed by, but I walk like fast. I'm like, no, I don't want to. Like, it just
not for me.
No, not for me. Honestly, because when I saw that, like, and then I saw because it was an old lady, and I was just like, man, that could be like one of my family members, and I'm just like, no, I don't want to feel that. Like, I felt weird that day too, because it was like my first time seeing something like that, and I was just like.
Yeah.
Do you guys? I don't think the security take the bodies to the morgue.
No,
we don't.
Who does?
No, that's transport.
Transport and the text. Yeah, but mostly transport.
Because at the ICU it was me and security. We'll take them.
Yeah,
you
we
guys
don't do that.
No, would you? Would you be scared to take people to the morgue?
I've seen it.
Bodies.
I've been there a couple times, even when during COVID. Because in our break room, we used to have like a big, what is it? What are those called? Those big trailers? No. Trying to forget.
Like a freezer?
Yeah, it was like a big ass freezer.
You guys
and
had those in your break room?
Not in the break room, but it was outside.
Where? I'm trying to figure out where. Because I
usually, you know where
I drop you off?
Drop me off? There used to be a big... Oh, it's a container. It was a big container. Like and then it just had, like, bodies. But it was during COVID.
Yeah.
Because since our mortuary, it's small.
Yeah, you can't.
So
where are you going to put them?
They had to put them there. And we were just like, are you serious? Like, right here in front of our break room? But... I don't know. It was weird.
See, you could go to therapy for that.
Yeah, and then they would literally clean it out too.
Yeah. No, but remember, he's a happy person.
Yeah. But even, but I'm saying, like,
even if I'm happy, you know?
But like, there are things that you can, like, I talk to my therapist about everything, everything, and then like even during my grief therapy, they like I look back at my notes and I started talking about like all these other things that like that's not what I intended to go for, but that's what we ended up talking and unpacking all of these things of like. Oh, you think of this and then you build because of that, and have you thought about this? And I'm like,
I'm so scared of writing my thoughts because I feel like I've been through a lot as a kid. Yeah. Not that I'm embarrassed, but I wouldn't want my kids to read it. I don't know why it scares me.
It's a lot to face.
So, so I did. And at the time, my partner, he spoke only Spanish, but so I will write in English. And then I'm like, well, my kids are going to understand, you know, because I feel like with kids, like if I have a book and they see me writing and then if I lock it, they're going to want to, you know, kids want everything that they can't have. So then I'm like, I would just like do it when they were not home. But then it's like, I want to be like you. I see all your writings, even like when we started doing like what is it, like the calendars or schedules. Yeah, so I love that Gabby has like, oh, this month happened, and then she has like little pictures, and I'm like, that's so cute.
Yeah.
And you go back and you're like, oh, I was happy here, or how I felt this. That's nice to see.
Yeah.
But then I'm like, I don't want people to just like,
well, you can do it anonymous, right?
no. Like, I don't want to be able to somebody find that book.
What?
Oh,
Spooky.
babe, the
light.
maybe just like plug it up. Oh my god, we need to do before October ends, like a spooky
A scary story.
yeah, because Emmanuel has seen a ghost at work.
Oh, hell no.
So we think it was a ghost.
Like,
I don't
define
know.
ghost.
Cause okay, look, the thing is, it was me, the supervisor, and Gerardo. We were closing up West Tower, and then we're like outside where it crosses between the east and west. We were talking. I don't know where we looked to the right, and you know how there's a bridge connecting to the North Tower. We just see a kid sprinting, little white kid.
What time was it? What time do you guys close?
8 o'clock.
Well, also, there are no kids. There's no kids unit.
At the time, because it was during COVID, so there was no kids allowed, and it was like a little white kid wearing basketball shorts, white T-shirt, and a cap. He just ran, and we're like, "You saw that, right?" I was like, "Yeah." So the supervisor goes through the side door to take the staff elevators. Goes up. We go to the main lobby to see a couple visitors come out, but they're like older people. Kid never saw him. Our supervisor was like, no, I checked the whole area, nothing. And we're just like, to this day, we didn't even know if it was real.
You need therapy for that.
Everyone should just go to therapy for everything.
For real,
Yeah.
honestly.
Yeah, even if you're happy.
Happy.
I'm gonna have to go then.
Okay, so what advice would you give to people just about life in general?
I don't know.
No?
I don't know. I would
Say, what would you tell
Your
like
younger self.
or not like your younger self? I feel like or yeah, that's a good question
Yeah.
too. What would you tell your younger self?
Yeah.
Because of everything that you've been through.
Yeah.
Like talking about it, you don't like. I was telling Emmanuel, somebody told me at work something pretty heavy too, and it's like he's like, "Oh, I'm so sorry, I shared this," and I'm like, "No, thank you for sharing, because now I know like we all have a story."
Yeah.
You know, literally, we all have a story, and we just need to be more understanding
Yeah.
of people. I feel like,
Yeah.
Yeah.
yeah, and not be so angry.
I'm an angry person. It's fine.
No, you're not.
Oh, I was a very angry person for a couple of years.
See, so what would you tell your
I'm
younger
very
self? Or
you know, because when you sent me like kind of like the questions and stuff, I had talked to Ernesto about it because I was so nervous, and I was like, I don't know. I first said like, listen to your parents, listen to your mom.
That's a good one.
Listen to your mama's.
call your mom and say sorry.
Sorry, Mom.
But he's like, well, that may not apply to everyone, and I'm like, that's a good point. So he said, maybe, do you feel like it's
Because that's not gonna apply to me.
It's not, yeah, and it didn't really. It's not that it didn't apply to me. It's just my parents come from different understandings.
Yeah.
And then I also thought of the person who was like a parental figure for me, and that's my godmother, who's also known me since I was like 14 years old. And I've known her half my life, more than half my life now. And she was always there. And I remember her advice to me before going to college was, Gabby, don't go to college with a boyfriend. And I was like,
Excuse me, if you're listening. If
you're listening.
If you're watching to this episode that I want you to watch, no boyfriend.
And it wasn't that I wish I had like done what she said. It was, I wish I had like taken her advice into consideration. And I think ultimately, like what Ernesto and I had said was like, listen to your loved ones, like keep those loved ones close to you, and like you don't have to do what they tell you or suggest all the time, but take into consideration, like think about where that could be coming from and why they're telling that to you specifically, and that's like that's their love for you. So like my parents, they showed their love and like encouragement and support through their own ways, and my godmother did that in her own way, and that's why I am where I am today. I think a lot of it is because of the support I had through them. And so
it doesn't always have to be your parents.
It doesn't always have. No, it can be any of those loved ones. Like I had a lot of really good adults in my life. My grandmothers, my godmother, my parents, maybe that's not a lot, but more
something though.
Yeah, that might be more than what a lot of people have. And I think like listening, like just it doesn't have to be an adult either, just like your loved ones, like my sisters, you know, my little sisters still stuck around through all of that stuff, even like through navigating their things, like,
or maybe if you're going through something, I feel like, you know what I like, one time you texted me, I can't remember what it was, but it was like, oh, I texted you because I knew you were going to tell me what I don't want to hear.
Yeah, that's why I'm saying, like, because they're telling you, and I didn't want to hear that. I didn't want to hear, like, don't go to, like, break up with my boyfriend and go to college without my boyfriend. Like, what do you mean? This is the love of my life. And that's what, I didn't want to hear that.
Yeah.
But that could have probably saved me a lot of grief.
A few years ago, I remember, say I was going through something, like, I knew who to text so they could tell me what I wanted to hear. So then one time I texted my tia and she said, yeah, you know that I'm going to tell you how it is. So whenever you, like, we text whoever we want to hear.
Whoever's going to tell us what we want to hear.
Yeah, that's who you text. Who do you text?
Me? No one.
Happy kid.
I don't.
You don't text no one?
No, I don't. Honestly, I don't think I do. I think me, it's listening to, like, other people talk about their experience. That's who I go to. I don't know. To me, that's how I like it. Because I'm always on TikTok and I see like inspirational things or like people talking about their situation and their life. And I'm just like, okay.
Well, maybe don't go to TikTok. Maybe ask people around you.
That's true. But I always had that. Like, it was just my go-to thing. And especially because I didn't have a lot of people to talk to. Especially because I never went through those things. So what am I going to talk about? Or what if I felt like, are these the right questions, or are they gonna get offended because of the way I say it? That was something I wouldn't want.
Isn't that weird how, well, not weird, how there's like this happy people that don't have trauma, and then there's us.
Yeah.
We're still happy people. We just have trauma too, as well. Yes, and
and like me thing. With kids, like I've always wanted to protect my kids from what I've been through. And now I learned that you can, and it's out of my hands. I still try.
Yeah.
But it's just like I wish somebody was like there.
Yeah. To
like done that to me, like showed me or just say, hey, don't do this, don't do that. So if you have the knowledge of what you have today, would you still do it all over again? Like dating Chris and
hell no. I wouldn't have done any of that. Yeah. I would have listened to my godmother.
So, you know, there's this saying that...
Respectfully.
No, you know, there's this saying that says, oh, don't regret anything that you did because that's what makes the person that you are today.
But if I had the choice between going back and being traumatized and being sad and angry and missing some really important years of my life, I would... No.
Yeah,
no.
Wouldn't do it.
I didn't get to experience my college stuff because of that. Like, our relationship was very toxic. It was very controlling. I couldn't make friends. Yeah. Like, I talked to a handful of people in college. I wanted to join a sorority sooner in college. I wanted to travel abroad, study abroad, and I was told no. Damn. I was literally told, no, you can't do that. And if you do, I'm breaking up with you. No. Or if you do these things, I'm ending it. Like, I wanted to go out to a party with friends that were known to us for years. And he came up and drove up all the way to Santa Barbara to stop me from going out.
No way.
And I couldn't make college friends. Like, I worked really hard to be where I was, and I couldn't make friends because I couldn't trust people. How can you trust people? You don't know them. And I couldn't go out, and it was like, oh, everyone's out to, I don't trust the world, and so then I didn't trust the world, and it was like, I could have had more friends. I was a very social person. I could have had a lot more friends, a lot more connections. I could have been part of like more communities and supported myself through those communities. They were just like, I could have seen a whole different part of the world because of it, or I didn't because of it.
Yeah, there's a lot of things that if I knew, and if I knew that it was going to happen all over again, like I would not do it.
Even with the knowledge I had. Yeah, no. Well, because if I had the knowledge, I wouldn't do it that way. Yeah. I would have I would have listened to my mamas.
Yeah.
I really would have. Yeah, and I wouldn't have been.
Yeah. What are some things that you wish people in your life would have told you? Or maybe something that you would have liked to hear more?
I don't know. So I feel like they told me, I just didn't listen. Maybe I would have wished I would have listened.
Did your mom or your dad tell you, "Oh, Gabby, you're so beautiful"? Like every day?
I think my mom, no. But I don't think
you don't need
those
that?
things are, like, now when I look back on it, I don't think it was like...
Or you're smart.
Yeah. No, I think my parents, like, told me they were proud of me enough. I think maybe I would have liked to hear, like, you don't always have to be perfect. Like, even if you think you need to, like, you don't need to. And, like, it's okay to sit and enjoy the moment.
I was telling her, oh, that's so good. Because sometimes she's like, what do I do? Like, she constantly feels like she needs to be doing something.
Yeah.
And I'm like, Gabby, you are 30, you have a career, you have a job, like,
yeah,
just enjoy it. Maybe go travel, or like, you don't have to constantly be doing something.
Yeah,
just enjoy it. But as Mexicans, I feel like it's like we always have to, like, there's like, if you're sitting down, you're being lazy. Like, or
you could be doing something.
You could be.
The house doesn't clean itself.
There you go.
That's true.
Yeah. So, guys, we don't need to be perfect.
Yeah.
No need for that.
No.
And the last question, do you have a bucket list?
Yeah. Now I do. I think more now. Because now we're, like you said, like, we have a career. We have a job. We can do things. I want to visit more of the national parks. I think
that was so fun.
Yeah, I think that's a new bucket list item, is to visit as many as I can. No boys allowed.
That's fine.
He's like, don't throw me in the forest. No thanks.
I'm good.
Yeah.
So what have you visited?
I've only visited some, like, the ones near here. Well, yeah.
No, you just went to Yellowstone.
Yeah, but on the West Coast, I need to, like, venture out more.
We need to go to Arizona.
Yeah.
Have you been to the Grand Canyon?
Yeah. I camped in the Grand Canyon. It was really freaking cold, but we were there.
I haven't. We need to go.
We should go. Yeah. That. I don't know what else. I think just have, like, 2 more dogs. Live on, like, have a big backyard.
Yeah.
Like, not like a big backyard. With the dogs running around.
You want another dog, huh?
I do, but you don't want to.
No.
Well, it's...
What type of dogs
this is not
want?
little, but I feel like we need to move somewhere.
Yeah, we do.
To have more dogs. Hi, Theo. Hi, Theo.
Yeah.
He needs a buddy to play with.
Yeah.
Okay. Well, I think this is it.
Yeah.
Thank you for being here, for being our first guest.
Thank you for having
and more
me.
to come.
Yep.
And for sharing. I feel like this is very good. Like, I think it's going to help a lot of people.
Nice.
Just to see that it's okay to take medication if you don't feel happy, or if you feel sad, or it's okay to talk.
Yeah.
Like,
Talk
you don't...
to someone.
To someone.
It doesn't
Whoever.
have to be like your parents, friends. Just a stranger too.
Yeah, you can. There's a lot of...
It's okay to be sad.
Put it out there. I did. If anyone wants to read more, I don't mind sharing.
Yeah.
I'm okay with it. I think it's helped a lot.
I feel like I'm going to be your manager, and I'm going to push you to write that book. I'm going to get 10%.
Damn.
What? That's what managers get. They charge 10%. Yeah.
Yeah.
No, because you're a friend. Nothing.
Yeah, but business is business.
Yeah, you're right.
That's
So-
good.
I wouldn't be here without people like you, though.
Mhm.
You know.
See,
Yeah.
we get 10%. Well, I get 10%.
You get 10%. I'm cool.
You need to get
I'll
friends
just
like
support.
Gabby.
I'll get the book and read it too.
You need
Oh,
to.
thanks.
So you need to discover your friends' talents and push them to do something, and then you'll get 10%.
yeah, I got a lot of people.
These are the people that I'm talking about.
Yeah.
When you say like that, that's my advice. Stick with people like this.
Yeah.
Yeah.
Stick with people like me. Come to my podcast. Let's talk about your career choices. Let's talk about life and
Everything in between.
and just have, you know what I want. I made this too so my kids could see that no matter where you come from, no matter how poor you are, I feel like we're not poor. I feel like when they were little, I feel like I was struggling a lot. But this is what I want to show them, not because I'm a single mom or because we're Mexican or because we're not rich. I know a lot of nurses that travel the world.
Yeah, there's a lot.
That go to Japan, that go to Spain, that go to like everywhere. So you don't have to come from rich parents to enjoy life or to do something of your life.
Yeah.
Or, you could have no parents.
Yeah. and
Do
still-
you know nurses that have no parents? I don't think.
I don't know.
But I've known nurses that
They're just like absent people in their lives.
Yeah.
Like if they weren't that present, they still come out shining on the other side.
Yeah, so come to my podcast, to our podcast, and let's talk about it.
Yep.
Yeah.
Okay, thank you for being here.
Thank you.
Okay.
Bye.
Okay, guys, thank you so much. I hope you guys comment and subscribe and like, and we'll see you in the next one.
Bye.
Bye.